Um, so like Dia said, my name is Jackie, and I'm joined by Karen Reyna, and we're part of the group Somos TB, which is a peer support group for Spanish speakers. So first of all, a little bit of background, like Dia mentioned at the beginning, we are a sister organization of We Are TB. And for those of you who don't know, We Are TB is a national, and actually really it is multinational, but most of us are based in the US. And it's a advocacy and support group for those who have been personally affected by TB. Since the pandemic, so since November of 2020, We Are TB has been holding weekly meetings through Zoom. And so we came to know those meetings as support space. And so what support space is it really tries to create connections and just like facilitate communication with anyone who has ever been personally affected by TB. It really doesn't have to be a current or former patient. It can be a family member, a caretaker of anyone who has had TB. And yeah, so we're really trying to make connections, but usually we focus on so during our meetings, we focus on those who are undergoing treatment and then try to answer any questions that they may have or just provide our own experiences. And just so you know, apologize for the noise. This is not meant to be, we don't really give any medical advice. There are a few of us or a few members who are actually physicians, but we really focus on the support space and our, anecdotal evidence that we have. And so who's Somos TB? So in March 2022, Somos TB started offering monthly support space, or like our own little version of support space, but just speaking Spanish. So this is meant to cater to those who feel more comfortable speaking Spanish, because a lot of us were already, if we are, undergoing treatment, we're already so vulnerable, and it's an added, I guess, an added burden to try to think in a language that's not your first, right? And so the focus of the meetings is to be able to connect with other Spanish speakers who, again, are either undergoing TB treatment, have ever received TB treatment, or have ever cared for a patient with a TB diagnosis, whether it be latent or active TB infection. So we were so fortunate to get our mini grant last year. And so our plan was to increase support space, use social media to increase our, our visibility, because we're still, a fairly new group. And then also to be able to be present at other TB related events, and then maintain those collaborations or those connections that if we do make them at these events. And so we're happy to share that we did accomplish all of those goals. So we were able to increase support space meetings from monthly to bi-weekly. So we hold our meetings every second and fourth Tuesday of the month. And our lessons to learn from that is that this increased support space has allowed members who were already a part of our group. It has allowed them to get a little bit more confidence, because the more you talk, the more you become obviously familiar with other people, but like you become more like a family itself. And I noticed that in We Are TB, because I'm also an active member of We Are TB, and meeting weekly, it just creates such a connection that it actually also helps get new members, because when new members join our meetings, they can see how our relationships work and how we can, we're able to give support for anyone undergoing treatment, but also we don't have to talk about TB if we don't want to, you know what I mean? Like if nobody has the need, we can just be ourselves and be a part of this community, and so that allows for people to be a little more vulnerable, and we're able to just tackle, whatever challenges we're facing in the moment. Again, sometimes they're not TB related, or sometimes they're distantly related. We've had it all. And then of course, having 2 meetings a month, increases availability. So not everybody's available, just the second Tuesday of the month. But yeah, so this has allowed for more attendance, so to speak, to our meetings. And so one thing I do want to mention is that, sort of not a con, but like something that we can improve is that, even though we've been able to expand our group, we've more than doubled our members. It still feels limited. Even weekly meetings feel limited. So eventually we would like to offer meetings either weekly or more often than that, more frequently than that. So another accomplishment is that we were able to increase support space. Oh, whoops. Oh, sorry. This was our original picture. So another lesson learned is from using social media platforms to share meeting reminders, information on our group activities and events, and share gratitude posts to other TB-focused organizations who have made a connection with us or have invited us to speak at their events. These reminders really have been great for our other members, especially for the bi-weekly meetings, because again, not having like a set schedule and, just knowing that every Tuesday, for example, we're meeting, this kind of second and fourth Tuesday of the month sometimes can get a little confusing. So these reminders have been great. And I have to give credit where credit's due. Karen is so good at social media, and so she's been the one creating usually like these videos, these social media videos that focus on encouraging people to join us, and I love them. They're usually themed, and I love them, and that's what they look like on the first three pictures. And so again, social media has allowed us to share our accomplishments and then be able to be more visible to organizations who may not have heard from us, or other patients who follow a certain organization and then they get that connection through us. So something that, for better or for worse, social media has given us is that sometimes you get suggestions as to who to follow or what connections to make. And I think that's been helpful for us to get new members to reach out to us via social media. And then another great thing is, technically, I suppose this is social media, so the WhatsApp messaging app. We've created a group for Somos TB. So now, even though we don't meet as often as we would like, at least we have, that group in which we can communicate, at any time of the day. And whoever, we're in all different time zones. Some of us are East Coasters, some are West Coasters. Yeah, we're just able to talk to each other, whether it's, again, TB related or not. And especially because a lot of our members are not only primarily Spanish speakers, but they're not very fluent in English. So sometimes they ask questions just related to, hey, I have this prescription. Like, what does this say? When do I have to take it? And it's been very, very useful. And again, it's created more of a bond between us, which I really appreciate, and other members have expressed appreciation. And so something to improve is that, again, although we've made great progress in social media, we of course have realized that we need to maintain like consistency in order to make as much progress as we'd like. And of course that takes a lot more time, and we all have, this is our this is all volunteer from our end. We all have like our normal full-time jobs. So I think I got actually some tips from another mini grantee as to how to tackle this situation and how to be more, how to get a little better at gaining visibility either through social media or just through our website and et cetera, how to advertise ourselves better, so to speak. And so another accomplishment is to represent our group in healthcare related events where we can promote support space. We can network with other healthcare providers and any other TB related organization, and also to stay educated on information relevant to TB, because it's just, that's part of the anecdotal, like, or part of the experience that we can share with newer members. Sometimes we share scientific papers. Again, even though we're not doing the investigations ourselves, you know, people can read them and then get to their own conclusions. I'm actually just now coming from, you know, an event that from a connection that I made, and this group at Weill Cornell, they, you know, they have these like webinar or not webinar seminars about scientific findings on TB, and it's just always super interesting to see what's new and what's like a possibility, you know, especially like in terms of diagnostics, vaccines, etc. And so in the picture here, you can see Karen. She's representing us at the NTCA NAR conference, which was held in Baltimore this year. And then on the right, I'm there with Koa and Mary, and our representative from California, or she's the aide from a representative in California, and we were doing advocacy in DC. And so another accomplishment, oh, actually, sorry, I'll go back a little bit to this slide. So something that's been really, really helpful for us is that Karen is actually working in a TB clinic in Atlanta. And so we've been very, very lucky that we get that one-on-one, that someone from Somos is, you know, has that one-on-one interaction with other patients. And, you know, we know for sure that our information is being passed along, but, you know, that's not always the case. So I just wanted to, this will come up in a later slide. But yes, so this is an accomplishment that we've been able to promote TB or promote Somos TB in these types of events. And we've been able to maintain connections and, you know, increase our visibility. We're happy to share that we were selected as a TB elimination champion by the CDC. And so I do think that really helped, you know, sort of advertise Somos TB. And so these conferences like the NTCA NAR conference, those have always been imperative for We Are TB. So we learned that from We Are TB. That's the only way other members really would see each other in person or would network with other people in healthcare. And those are only held like once or twice a year. So now that we've been able to network a little more through webinars and through, you know, just like networking with other groups that we may not have heard of in the past, I think because of support space and now with Somos support space, that's really helped us just like connect with other groups, and we can really, really see firsthand the benefit from these partnerships. Other clinics have been more open to partnering with us, and I actually hadn't anticipated that, but I do, like I said, I do credit that impact to like one-on-one interactions with them, just seeing them either in person or virtually, but just like having this connection where we get to talk and we're more than just a flyer or, you know, a social media post, which, like I said, there are benefits to that, but there are also benefits to actually meeting these people and interacting with them. And I truly, truly cannot emphasize enough just how good it is to have one-on-one interactions with other patients, and how that, you know, how that can really impact not only the patients, you know, mental and emotional health, but, you know, the clinics as well, because we don't have any, you know, scientific based evidence, but we know from experience or from interacting with other patients undergoing treatment, just how motivating it is for them to stay in treatment, from our experience, from seeing that like other people have gone through this and that there's, you know, the light at the end of the tunnel, and that, you know, they're not alone in this. So all of this just has been, I think, really, really helpful. Again, not only for Somos TB, but for the members, the newer members of Somos TB. And so just one little thing I wanted to add, this is like one of our flyers to advertise Somos TB, and there are several clinics who are sharing these, but yeah, we were able to get this done with the help of GTBI here in the East Coast. Thank you so much.